More importantly, we encourage children to get along with each other and play on the same playground.
Members' motion with no legislative effect. Mr. Ben Chan will move a motion on comprehensively reviewing and improving Hong Kong's dental service system and manpower needs. 4 members will move amendments to the motion. This council will proceed to the joint debate on the motion and the amendments. Later, I will first call upon Mr. Ben Chan to speak and move the motion. Then I will call upon Ms. Rebecca Chan, Ms. Joephy Chan, Dr. David Lam, and Mr. Lee Chun-keung to speak in sequence, but they may not move the amendments at this stage. The joint debate now begins. Members who wish to speak, please press the Request to Speak button. I now call upon Mr. Ben Chan to speak and move the motion. Thank you, President. President, I move the motion as printed on the agenda be passed. That is the motion of comprehensively reviewing and improving Hong Kong's dental service system and manpower needs. The government should expeditiously formulate a 10-year development strategy for dental services. Dental health is of utmost importance to our smile as well as our daily life. Without oral health, it will affect our living standard and our dignity. It will also lead to malnutrition and the general health. At present, the public dental service system the public healthcare system of the government only focus on Western and Chinese medicine, but with no focus on dental services at all. Members of the public have to approach private dental clinics for dental services. With higher charges, grassroots people and elderly people are reluctant to get help. Now, there are 40 dental clinics under the Department of Health. Only 11 of these clinics would open up some service quotas on 2 days of a week for the public. There are only 4,000 public sessions quotas for the public each year. And members of the public can only get 1 tooth extraction service each year. So the 11 clinics would normally be providing employee benefits for civil servants. The dental services are offered to the civil servants only. Some say that there are lots of help for the general public. There are the community care fund, outreach service for the elderly people, and also school dental care services. So what more do you want? Well, it sounds that there are a lot of programs, but let me walk you through the details and find their lackings. Now, Mr. Holden Chow always raised his concerns over people having to wait overnight in the cold for a public session quota. And even if you get one, you will only get a tooth extraction service. If you have 2 teeth which need to be extracted, you have to come back again. Now, according to a survey, more than half of people with oral health issue did not seek dental health care services because of lack of financial means. 70% of them are not eligible for the CCF dental assistance program. And they are worried that because they are only eligible for the assistance program once, they are reluctant to apply for it. It shows that there is insufficient publicity and education. Now, last year, when the government responded to our question, the government said that the government's policy on dental care seeks to improve oral health and prevent dental diseases by raising public awareness of oral health and encouraging proper oral health habits through promotion and education. Well, of course, promotion and education are important, but it is very passive. We always ask whether the government can be more active in helping the public. Well, the answer we get is that the dental clinics are all at full capacity, and also they are mostly for fulfilling the employment terms with civil servants, but not for serving the public. What about our dental manpower? According to the healthcare manpower report, we have some 2,000 dentists in Hong Kong. 30% of them are public sector dentists, and the remaining 1,800 dentists are serving the 7 million population as a whole. So there are 2.6 dentists per 10,000 population. Well, it is essentially a third world standard. Well, why is the government ignoring the public's need for dental health services and does not provide a safety net in terms of dental services for the people? According to the 2020 Healthcare Manpower Report, in year 2040, there will be a shortage of dentists. In 2030, there will be more than enough paradental professionals in Hong Kong. Well, I suspect that the government has been using past data in making this estimation. There are many people who can't have access to dental services, and also some people choose not to join the queue at all, so their needs are not being considered. I hope the government will reform our dental healthcare policy. First, we have to revamp the basis on how we make projection for dental health power and also improve the per capita dentists in Hong Kong. Now, in the short run, the government should address the manpower shortage. I urge the government to streamline the requirements for non-locally trained dentists to come to serve in Hong Kong, and also enhance the function of dental therapists in the establishment so that more comprehensive dental services can be offered to adults. And the government should also enhance its capacity in offering public session consultations. The government should also make the position more attractive so that more dentists will join the public sector. And also locally and also in the mainland, there should be dedicated dental healthcare vouchers for elderly people so that they won't have any reservations in using them locally or in the mainland. And also the government should enhance education on oral health in Hong Kong so that the public can enjoy a better oral health in the short, medium, and long term. And also, the government should consider introducing more non-locally trained dentists to serve in Hong Kong, as well as enhancing collaboration with NGOs and establish outreach mobile dental service teams comprising periodontal professionals to alleviate the pressure on dental clinics. And also, the government should increase the training places as well as training institutions on dental professionals. And learning from Singapore, besides the dental clinics, the government should increase and engage private units, including university and dental clinics, to offer dental health care for the public. In the long run, most ideally, dental services should become part of our regular public health care service so that we can extend the safety net and also allow elderly people and the general public enjoy dental services and be protected by our healthcare system. President Xi once said that people's aspiration for a better life should be the goal of our strive. Our target should be that in 10 years' time, we should enable public's access to premium dental health care services without adding extra financial burden on them so that they can enjoy better dignity and also put a smile on their face. Thank you. I so submit. I ask members to support my motion.
議題係
I now propose a question to you that Mr. Chang Han-pan's motion be passed. Ms. Chen Hoi-yan. Thank you, President. I would like to say out clear that I believe currently what we are facing is that we do not have a comprehensive dental care policy in Hong Kong. Currently, the general public dental sessions are only those extra quotas that remain, and so this is very pathetic because it only provides emergency services, so it can only provide the treatment of pain relief or teeth extraction, and it's not actually a comprehensive dental care service. As Chan Han-pan said, there is shortage of quota, and actually for retired civil servants visiting the dental clinics, they also need to wait 30 months. And therefore, there is, of course, no extra quota for the public. The public also needs to wait for a very long period of time. Increasing general public sessions is something that I've already mentioned to many of my colleagues, but because of time constraint, I'm not going to repeat it. I just want to raise one main point, which is to actually, we must actually improve the positions of oral dental therapists. I'm sure that the best policy out of all services is the school dental care service. Currently, students can receive health services every year other than scaling and polishing. It also includes teeth extraction and also healthy teeth education. The government keeps on saying that there is a shortage of manpower. However, we do see a very comprehensive school dental care service. Actually, for the students, the dentist or the oral therapist only act as the supervisor, and actually the therapists are those providing services. I have been to the school dental care service, so it's actually one dentist together with other therapists, becoming a whole team of dental therapists. So actually you do see the smooth flow of services, and there is actually very strong division of work. The school dental care service has been very successful all these years, and it reflects dentists and also therapists working together to come up with such a strong team. With adequate manpower to provide scaling and polishing and also fillings, then the public will not need to wait for acute or emergencies to visit the dentist, and actually it can alleviate the pressure on the dental clinics. However, under the current policy, there is no improvement, and actually the oral therapists are not being used wisely. Currently, their work is actually binded by their job nature. For example, they can only provide services to those under 18 and can only work in the school dental care service under the Department of Health. Therefore, they are not able to take care of the oral health of the general public. And there's actually a shortage of oral therapists because there's been a suspension of training. But then, even though it is resumed in 2016, there's only around 300 dental therapists to cater to the needs of the school dental care service. Therefore, of course, there would not be any increase in dental services. It takes 3 years to train up a oral therapist, which is actually half of the time needed to become a dentist. With better planning and to provide more training for the therapists, actually we could come up with a solution for the shortage of manpower, and will also be able to improve the dental services provided to the general public. The chief executive also set up that there was actually going to be a review of the dental services. I hope that you could actually look into training up and through dentists working together with the oral therapists, such as the service provided to students, to gradually set up a comprehensive oral service to really take care of the oral health of the general public. I support the motion by Mr. Chen Hanpen. Ms. Joephy Chen. Our colleagues have talked about the different levels of service provided to the general public. I want to highlight elderly. Actually, we're now in a very aged population. Those above 65 or above actually take up 20% or above of our population. By 2030, the elderly would take up 30% of the general population. And actually, people live longer now, and so the average age is around 85.2 to 90.9. And for the elderly to feel healthy, then of course they should have strong teeth. But I see that many elderly people have lost all their teeth, and they suffer from that. The CE in his policy address set up 100 KPIs. And there are actually objectives and KPIs that can be used for dental services. I hope that the government can also take reference from that. The WHO suggests that 80% of those above, that there should be 80% of healthy teeth to ensure that they'll be able to chew properly and to have a healthy intake of diet. In 2018 to 19, only about 37% of the elderly are able to enjoy dental services. Currently, there are only 2,700 registered dentists in Hong Kong, which is actually a number much lower than those in Singapore and Japan. There is a need, therefore, to increase training in Hong Kong and to actually have dentists from overseas also registered in Hong Kong. For expenses in dental services is actually very high, from around few thousand to tens of thousands of dollars, and the $2,000 elderly health voucher is not enough to meet the needs. And those living under poverty cannot, of course, afford these high dental expenses. The general public, therefore, sometimes would go for mainland dental services. The government should open up the elderly health vouchers to the Greater Bay Area. And I hope that other than the elderly healthcare voucher, there could also be a dental voucher. Every year, we see around 40,000 people using the general public sessions, which is 90% of usage, and about 60% of them are elderly. Therefore, the government must increase the number of clinics to meet the need, and there should be dental clinics in all 18 districts. I'm sure that healthy teeth can enhance the happiness of the people, and we should try to provide comprehensive dental services on behalf of the FTU. I hope that we'll be able to come up with dental vouchers to actually help refer those to private clinics, and in the medium term to increase the quota for dental students to attract more talents. And in the long term, there should be clinics in all 18 districts so that services could be provided to everyone. And we have come up with a $100 million proposal to provide better services, and a recurrent service should be adopted by the government. In general, I hope that we would not be toothless, and that everyone will be able to enjoy healthy teeth. And with the easing of the pandemic, we'll be able to remove our masks soon. and we hope that we'll be able to see smiles from everyone showing their healthy teeth. To rank world number one in dental college, I really think that we should improve our dental services. Dr. David Lam, thank you. I'm happy to see that the government has set up the Oral Health Education Division to review oral services in Hong Kong. All along, there has been neglect on oral services in Hong Kong. Originally, services only provided to civil servants. Only 11 out of 40 of them provide service to the general public, and it's only open for one session in 1 week. The school dental care service caters to primary students, ensuring their oral health and to help them with scaling and polishing and also teeth extraction. Therefore, secondary students usually would see healthy teeth. However, the program does not extend to secondary students, and they would not go for annual checkup. Therefore, when they grow older, their oral health will suffer, and that actually compromises the firm foundation set by the school dental care service. Therefore, I just suggest that the SDECS be extended to the completion of secondary school. In the past, there is also a program in teaching students about oral health. I hope that this should also be extended to everyone to enhance health education, which includes oral health. So what happens before primary school? Half of 5-year-olds have seen cavities, but 90% of them do not visit dentists, and no treatment has been made from the year 2000 to 2020 to 2021. With the support of the Hong Kong Jockey Club, a 3-year program was set up for those pre-primary students. But then this is only a 3-year plan, and it's almost completed. So would it actually become a recurrent program? As for the elderly, there's an outreach dental care program for the elderly, and also the elderly dental assistance program, which provide services such as extractions and providing dentures. But prevention is better than cure. I hope that there will actually be supported subsidy given to the elderly for scaling and polishing. I suggest that the government would draw reference from SDCS and to use the health clinics to provide dental care services for the elderly and for grassroots to provide basic services such as oral checkup and also scaling and polishing, and that can really alleviate the situation of the elderly suffering from being toothless. And out of the 2,000, there are 2,706 registered dentists in Hong Kong, about 531 oral therapists. There's actually not adequate manpower to support the services for the general public. I suggest a partnership be made between public and private, and to provide more quota to students. We should consider opening up another dental health hospital. We only have one right now. After QE Hospital we can actually set up another dental hospital, and also to provide more training to dental students. I believe we could also open up to registration of overseas dentists. In the long run, we should actually consider dentists also be part of our basic medical plan. So we should also respect the dentists as well. Thank you.
Mr. Michael Lee. Madam Deputy, I believe everyone would like to have a set of shiny teeth like that of Miss Rebecca Chan, which she has been complimented for by the CE. Now, with poor dental health, it is really a torture for anyone, especially for elderly people. If they lose their tooth or have poor dental health, it would affect their appetite, and they would become malnutritioned, and they would have lower immunity and thus higher chance to be hospitalized. Now we have one of the top 3 dental schools in the world. Still, we don't have enough dentists, thus rendering dental services a major gap in our healthcare system. Now, Hong Kong is an advanced economy. According to the WHO, in industrialized countries, the per capita dentist should be 0.5 per 1,000. Now in Hong Kong, our ratio is 0.3 to 1,000 population, and also every year we only have 50 dentist graduates. The manpower shortage is huge. Close to 90% of dentist schools that graduates would join the private markets immediately after graduation, thus widening the gap. Now, dental healthcare services is not part of our public healthcare services. We only have 11 public dental clinics offering some 4,000 free general public session quota places for the public. Many people have to endure the pain and join the queue overnight. According to a survey, a lot of elderly people would rather wait overnight in the street for tooth extraction service because the private service is simply too expensive. And also, even when they get this, there is no guarantee that they can enjoy the service they need, because one quota place only comes with 1 tooth extraction. If you have 2 teeth that need to be extracted, you have to come back again. Now, the government has promised to establish a working group to review Hong Kong's dental care services. I welcome the idea. The root problem, however, to alleviate the huge demand for dental services in Hong Kong, we have to increase the number of dentists generously. We have to increase the number of trainees, and also we have to lower the threshold for non-locally trained dentists to come serve in Hong Kong. We have to introduce dental healthcare professionals from the mainland and the world to alleviate the manpower shortage. I thank the government for accepting the Liberal Party's call to amend legislation and welcome non-locally trained doctors to come serve in Hong Kong. Now, we should also set up a limited registration system for dentists to serve in Hong Kong and make our system attractive to dentists in the mainland and other places in the world so that people can have hope. And also, according to the primary healthcare blueprint delivered by the government, I believe that the 18 district health centers, or DHC, should conduct activities to educate the public on the importance of oral health. We should raise their oral health awareness so that they would have lesser needs to get dental surgeries. And also DHCs should, and also dentists in the community should also serve the public better and make referrals, accept referrals from the public healthcare system. We have to address the gap as soon as possible so that people can enjoy a sense of well-being in Hong Kong, and also to have a bright smile. Thank you so much.
Secretary for Health. Madam Deputy, first of all, I thank Mr. Ben Chen for moving the motion on reviewing and improving Hong Kong's dental services and manpower supply, and amendments moved by other 4 members. members are concerned about the dental services and manpower supply, and they've asked that the services be reviewed. This is, in fact, in keeping with the government's objectives. The government is actually taking forward all these initiatives. So today, I'm really pleased to be here to listen to members' views. I would look forward to members' recommendations in this regard. The current dental care policy is in threefold. We do prevention and we help the underprivileged, and we also provide emergency dental services. In terms of prevention, we resort to publicity and education to raise the awareness of oral hygiene, and the government has already rolled out the primary health care blueprint, and oral health is one of the most important areas under this. So the government will be mounting publicity and education to promote oral health and also to nurture a good oral health habit for the younger generation, for them to have a good habit. We provide the dental care for them. If they can maintain good oral health, then the need for complicated surgery arising from dental decay will be greatly reduced. So the members of the public should maintain good oral hygiene and prevent dental disease. On the other hand, the Department of Health is adopting a prevention-based approach to provide oral health education. The Oral Health Education Division is conducting a lot of promotion programs. The DH is providing dental care service at primary level. We do have the dental care service. Students are arranged to receive dental checkup on an annual basis, and this would include checkup as well as dental treatment and preventative services. For the intellectually impaired, we do provide a whole raft of measures. The DH has targeted measures to help the intellectually impaired people and the carers to learn about the oral health techniques. From the school year 2013-14, for the special school that are taking part in the dental care program, the students can avail themselves of the services until the age of 18. Also, the government has launched the Healthy Teeth Collaboration Program. We join hands with 5 NGOs to run dental clinics to make available the dental services to the intellectually impaired individuals. This program has been extended to July 2024. In order to improve the oral health of the intellectually impaired people, we have made available the oral health service for children under 6 who are intellectually impaired. We started this in the Hong Kong Children's Hospital, and we have also extended this to outreach service and provide checkup and treatment for those in special childcare centers. For those with financial difficulties, the CSSA recipients will get the dental grant to have their teeth attended to. And under the outreach dental care for the elderly, we have set up 23 outreach teams to provide the dental checkup and dental treatment for the elderly people who are living in the RCGs and the daycare centers. Under the Community Care Fund, we have the Elderly Dental Assistance Program. This was launched in September 2012, and this is to provide dental care for the low-income elderly people. We are providing the denture services and various other dental services. In order to further extend the program, we have already extended this to those elderly people above the age of 65 who are OLA recipients. So all OALA recipients are entitled to this service. Starting from July 2021, we have extended the scope to cover many other different items. And the items included are the removal of dental bridge and dental crown, and also root canal operation. And for those above the age of 75, if they have used the service before within the last 5 years, they would be entitled to a second treatment for the fitting of removable denture. Other than the services I mentioned, the government is also taking advantage of the healthcare voucher scheme for the elderly, and this to provide assistance to those aged above 65. And with this voucher, they can use the services in the private sector for dental checkup, scaling, extraction, and fillings. The elderly are entitled to $2,000 worth of voucher, and they can keep the spend amount up to $8,000. Other than the services for the specific groups I mentioned, the government also has made available services to cater for the emergency dental care. And the 11 dental clinics are setting aside certain sessions to provide emergency dental care. And this is what we call the general public sessions. The scope of service includes the emergency dental problems, pain relief, oral abscesses, and extractions. We understand that this is hamstrung by the manpower availability. So the supply of manpower is something really dear to our heart. In order to tie in with the manpower needs, we have liaised with the UGC to increase the training places. In 2022-23 to 24-25 for the triennium, the first year, first degree training places in dentistry will be increased from 80 to 90 places. In other words, in the coming 5 years, we should have well over 400 graduates who will be joining the registration to make available their services. And also in the triennium, the government will be providing 10 taught postgraduate places to provide training places for specialist dentists. For the introduction of non-locally trained dentists, from 2015, the licensing examination has increased from 1 sitting to 2 sittings. We have also optimized a lot of the arrangements, and their results can be retained in order to entice and to facilitate more non-locally trained dentists to practice in Hong Kong. Also, as indicated in the policy address in 2022, we will take reference from the amendment to the medical practitioners arrangement to introduce more non-locally trained dentists to Hong Kong. We understand the keen demand for dental service, so in 2022 policy address, we have undertaken to review the dental service, including the policy objectives, scope of service, and delivery mode. In the end of December 2022, we've already set up a working group on oral health and dental care, which will be tasked to review the dental service, the long-term strategy, and also the mode of service delivery, and there will be input from this working group. We will be taking into account the views expressed by members today, and we will be making further response later. Thank you.
Mr. Scott Leung. Thank you, Madam Deputy. I speak in support of the motion. That is, we should urge the government to formulate a 10-year development strategy for dental services. But the key to quality healthcare services is speed. With a long delay, the situation will get worse, and in the end, the cost will be higher, and there will be more stress on healthcare professionals. Now, dental healthcare is very important to our health. For people who are financially indisposed, they have to wait for general public sessions. The government has not set up a comprehensive dental service system to serve the public as a safety net, and there are also insufficient services for elderly people. We don't have tooth filling service, and also in a general public session, you can only extract one tooth. If there are more than one teeth with problems, you have to join the queues again and again. It is so counterintuitive. We need a human-centric and comprehensive dental service system. Here are my suggestions. In the short run, I hope the government can enhance the existing services. For example, extending the initial registration to all dental clinics, and also set up dedicated hotlines and quota places for elderly people, and also enhance the outreach services so that elderly people can book dental services at home. And also, besides the existing services, tooth filling services should also be made available at public dental clinics. And also, for each tooth extracted, the government should provide a denture for elderly people, so that elderly people can continue to enjoy a good meal. Now, according to the healthcare professional manpower report, more than 70% of dentists are serving in the private sector. For the upcoming dental service policies, for example, outreach dental care program for the elderly, and also the elderly dental assistant program, they will bring about more dental service needs from the public. So the government has to increase the supply of talents by making the trade more attractive. Now, our school dental care services have been very efficient in protecting students' oral health. This is a safety net for students. I hope the government can extend the school dental care services to secondary school students. All along, I have heard a lot of comments by my constituents about the importance of dental care services. They know that regular scaling can protect their oral health, but most elderly people don't have this habit. It costs several $100s, and the annual $2,000 from the healthcare voucher is insufficient for this purpose. Preventive is always better than treatment. The government should offer regular preventive dental checkups and dental care services for those above the age of 65, along with primary dental health care. Now, many people prefer going to the mainland for dental services. The government should collaborate with the service providers in the mainland to offer such services in the GBA. Finally, the government should consider offering dental health care vouchers, as well as mobile dental service vans to maintain oral health for the public, because this will reduce the likelihood of other chronic diseases and hence alleviate the pressure on the public healthcare system in the long run. It is high time to review the dental service system, as well as review the manpower supply. The government should respond to people's needs and formulate a 10-year development strategy for dental services to put more focus on prevention and also offer comprehensive dental services so as to enhance the general public's dental and mental health. Thank you. Dr. Chow Man Kong. Madam Deputy, dental services in the public sector is very tense. It has always been troubling the public, especially elderly people. Now, we have 1/5 in the population who are elderly people. In year 2036, they will account to 1/3 of our population. The situation will persist for 3 decades. The situation is so bad as it is that the government should conduct a comprehensive review on our public dental care system, especially the manpower supply. It simply won't do if we have hardware but not the software to run them. So I support the original motion. Now, for general public session services, there is a very severe competition. Curiously, previous health ministers have been ignoring the problem. People have to wait 12 to 18 months for a session of dental service. Now, for ENT, the eye departments and other departments, the waits can be as long as 100 or 200 weeks. The situation is just as bad. And because of the closure of borders, elderly people and grassroots people can only join the queue in the small hours on the street to wait for the service provided by the public dental clinics. Well, they would only be open one morning in the week and offer very limited this to the public. Frankly speaking, Hong Kong is not the only place in the world with such a dire situation. But the point is, do we have a plan to address the problem? In 2021, more than 1,000 dentists withdrew from the NHS system in the UK. As a result, a lot of places, a lot of districts were not served by dentists. Some hundreds of thousands of people were denied access to dental service. Some people even resorted to extract tooth at home. Well, we certainly don't want the situation to repeat in Hong Kong. Now, we have the CCF Elderly Dental Assistance Program as well as the CSSA's dental grants, but they are very limited in terms of scope. So the government should consider establishing a dedicated dental healthcare voucher with an amount of 2,000 per year so that people above the age of 65 can enjoy private dental care when needed. Now, about the Elderly Dental Assistance Program, the government should pay attention to the quality of the dentists enrolling in the program. There are a lot of criticism. In year 2021, over the past 3 years, the Department of Health has received some 343 complaints, but there were never any action taken. I've also received a lot of calls for help from the elderly people that a lot of dentists under the assistance program, either in the private sector or run by NGO, were unscrupulous. They would exhaust the means to use up the amount of the elderly healthcare vouchers. Say, for example, dentures, which are not needed. Now, if you are taking this sum from the elderly people, it would hurt their wallets a lot. Now, I think you should ramp up regulatory measures. For example, asking the patients to fill in a survey after the session. If they are unscrupulous dentists, they should be held accountable. Now, Japan has a very robust dental healthcare system. Since 1989, the health departments and a dentist organization have been promoting a campaign to help people above the age of 80 to keep at least 20 healthy teeth, so that they can continue to eat food and also make sure that they have regular checkups. Now, in Hong Kong, we have a very severe shortage of doctors. Now, in the mainland, for every 10,000 people, there are 4 dentists. In Hong Kong, there are only 3.7. Now, we really should consider introducing overseas or mainland dentists to come to help us. Thank you.
議員
Mr. Kisson Yang.
恒斌議員全面
Madam Deputy, I support Mr. Ben Chen's motion to review and improve dental services. The government attaches a lot of importance to publicity and education. In the 11 dental clinics, the government provides public dental sessions, and there is a huge demand for the service, and there is a shortfall in the service. Even with the voucher scheme, it is not a panacea, and they simply cannot meet the bill. In Hong Kong, there are 3 pain points: a shortfall of dentists, and most of the dentists are practicing in the private sector. There are 312 dental officers, and there is a vacancy of 50 in the government sector. Less than 10% of them are working in the government. And there is a lack of primary care for the dental service. I think the government ought to resolve this problem. We have 2,700 dentists, 3.7 per 10,000 people. In Singapore, it is 4.1, 5.16 in Australia, 5.6 in Canada, and more in Japan. The supply of dentists in Hong Kong has been very, very slow in its growth. There are 73 more this year, but with an emigration of dentists and also the suspension of the licensing examination, there is a shortfall of dentists. So the policy address is introducing non-locally dentists, which has my support. Now, what is the targeted ratio for dentists per population in Hong Kong? Now, with this ratio, we can work on the plan. There is a competition for dentists in other parts of the world. Dentistry is a high-paying job. In Australia, the highest pay profession is dentist. In Canada, it is the second highest paid profession. They're earning 290,000 Canadian dollars per year. I think the government has to amend the legislation to allow the dentists to register after 5 years service in the government. And I think we have to extend the scheme to non-local permanent residents. The government should also deal with the distribution of work between the public and private sector, because even if we increase the number of dentists, the services will still be unaffordable to the public. So I support the policy address proposal. And also, when new dentists are introduced to Hong Kong, we should be able to provide a wider range of services. And we, in the long run, I think the government should tie in with the next 10-year hospital development program to build dental hospitals. In other parts of the world, in Singapore, they have the low-cost services like filling, denture, root canal treatment, and so on. They also have the social insurance protection for those above the age of 65. They will be subsidized for fillings and scaling. In Australia, children under the age of 17, they have $1,000 worth of dental care. And between 2015 and 2024, they have the National Dental Care Program. And only a small proportion of senior citizens are edentulous, and they also require the dental checkup on a regular basis. And I have to mention Japan here. In 1989, they have the program to make sure that 80-year-olds should keep at least 20 teeth. And Canada, they have the National Dental Care Program in 2022. They have already rolled this out universally. And these are the examples that we should take a leaf out of their book. We should have the safety network and develop a system where people should have a regular checkup. So by the time they hit twilight years, they should still keep the whole array of teeth. Ms. Chen Yiming, Madam Deputy, I'm grateful to members for moving this motion to review and improve Hong Kong's dental service and manpower needs and see how we can make improvement there. I support this motion. There is a keen demand for dental service, and this is as plain as clear as day. There are 2,300 registered dentists. Only 30% of them are working for the government sector. For each 100,000 people who have 3 dentists, according to the WHO, in industrialized countries, per 10,000 population, we should have 5. In Hong Kong, we are lagging far behind the international standard. We have scores of new dentists joining the rank each year. If we do not address the supply, it would be hard for us to achieve any improvements. So the motion today is really warranted. The dental care service and the manpower supply should be comprehensively reviewed. We should have a written branch review. Toothache is really worse than having a serious illness. We have dental clinics in Hong Kong, but they're catering for the civil servants. And the dental clinics providing public service only stands at 11, and they are providing pain relief and extraction. And how on earth are we able to meet the demand? We have a few dozen graduates each year. Well over 80% of the graduates would be joining the private sector. It shows that in the public sector, it would be hard for us to maintain the level of service. There are many dental clinics out there in the market. If you suffer from toothache and you visit the dentist in the vicinity, you may not be able to see the dentist straight away because there is an appointment system. If you are lucky, you would be able to see the dentist, but otherwise you would have to wait anything up to 1 to 2 days. Now, this is the general practitioners. For specialist dentists, the situation is even more serious. There are many children who need braces, but orthodontists, the number stands at 73. And I mean, for root canal operation, there are 24 or so specialist dentists who can deal with the pulp problems. The waiting time would be about a month, and they are charging an arm and a leg. And because of this long waiting time, many of the people who suffer from toothache would visit the dental clinics in the GBA. But because of the border closure, many have to be stuck in Hong Kong, and there is this is aggravating the problem. And with the aging population, there are more and more senior citizens who need dental service. In the private market, the prices, the fees are really fluctuating, and people are held over the barrel in this regard. So we do need to have medium, long-term measures for people to get dental service in the public sector at a reasonable price. So this is going to benefit the general public. The original motion and the 4 amendments are proposing measures for the government, and I hope that the government will heed all these recommendations and make improvement. Hong Kong is part of the GBA, and I do hope that the government would set up a mechanism for people to obtain good quality dental service in the GBA. I fully support the motion. Thank you. So I speak. Mr. Chen Xiu-hong. Thank you, Madam Deputy. I rise to speak in support of Mr. Ben Chen's motion to comprehensively review and improve dental service and the manpower needs, and all the amendments as well. In our healthcare system, there is a lack of primary care for dental service. The dental care provided by the DH is limited to emergency dental service and extraction. It is putting a lot of emphasis on the education for the primary students and for the elderly people and those in financial difficulties. There are also services made available. The government's strategy is to mount publicity and education for people to develop good oral health habit to prevent dental problems. So that they're not providing comprehensive dental services. The fees and charges are pretty exorbitant in the private sector. This is beyond the affordability of the general public. Prior to the pandemic, people would visit clinics in Shenzhen because of the reasonable fees. I think dental service is just as important as the primary care. So I support this 10-year development strategy for dental services as proposed by Mr. Ben Chan in his motion. I think that the policy should be revamped and the scope should be broadened. According to the DH's information, as of March 2022, we have 2,700 registered dentists. Per 10,000, we have 3.6 dentists, far lower than other jurisdictions of similar economic status. The workforce, we have lost 84,000 people to emigration. A lot of them are dentists. And in the private sector, the clinics would be poaching the dentists from the public sector. And there is also a wave of retirement, and there is very much an exodus of dentists from the public sector. And the services have been delayed and delayed. Even the dental checkup would be a year and a half now. In 2022-23 to 24-25, the government is going to be increasing the first-year, first-degree places for dentistry from the current 80 to 90. But it would take time to train up a dentist. It would take 6 years minimum training and another 4 years. This is not offering any immediate solution. So I think the government should identify other solutions to increase the manpower supply. The government should introduce a limited registration system to ease the demand, ease the supply. The PPP is also a way forward. The government might say that the senior citizens will have more of a need for dental care, and they have the healthcare voucher scheme, they have the outreach service for the elderly, and the CCF Elderly Dental Assistance Program. But the voucher scheme is only $2,000. They would spend half as much on dental care or more, and they have to leave a certain amount for their medical attention. They may be able to save up to $8,000, and they can't be bothered using the voucher for dental care. And there are also the dental care for the RCHGs, elderly people, and this would be limited to removable denture, and this is not addressing the actual needs. I think with the public-private partnership, the senior citizens will be able to enjoy the services from the private sector. According to the government, they have taken into account the 2021 oral survey, and they have set up targets for different age groups. The secretary said that they will be reviewing the system. I hope that the review will be completed soon enough and come up with a 10-year program. With these words, I support the motion and all the amendments. Thank you.
Mr. Chan Hock-Fong. Thank you. Healthy teeth is actually an aspiration of all. In the Song Dynasty, a person once said that those who actually want to survive want healthy teeth And this saying has actually lasted for over 800 years. Now, what we need to do is actually to provide dentures, and yet it is not affordable to all. Through today's debate, I hope that the Secretary will consider also expanding our basic Medicare to dental services and also to increase the number of dentists so that people will not have to suffer from toothache. Under the D8, there are now over 40 dental clinics, mostly providing services to civil servants, and there are around 4,000 quotas for the general public each month, which is totally not enough. And the general public can only receive tooth extraction or treatment of pain relief there, and only one tooth can be extracted at a time, so it is totally not people-oriented. We hope that the government will improve the dental services and to provide a one-stop service. To expand dental services, most essential is manpower. At the current moment, there are not enough dentists. Out of every 10,000 people, well, many people keep on saying that there are about 3.7 dentists per 10,000 people. Actually, the number should be 2.6, which is much lower than other countries. As I said earlier, the Hong Kong University Dental College actually ranks very high. It's actually a top ranking amongst the second out of all dental colleges in the world. We must try to attract GBA students and also students from the Belt and Road to study dentistry. And after graduation, we should require them to provide service for a period of time to provide a professional training to them at the same time. Ask them to stay behind to provide services. Other than training, how can we ensure sustainable development in dentistry? We must try to detail our plans for the future. For a new graduate in dentistry, to set up his or her own clinic would require huge funds. And it is not quite possible to do that. It would take hundreds of thousands to purchase equipment, and it is not a short amount. Many of them would not want to increase the burden financially because many of them would rather save up to get married or for their families. To open up their own clinics, they may have to delay their own family plans. Therefore, the government should provide interest-free support for dentists and also to subsidize scaling and polishing so that young people will be able to start up their own businesses. And this is actually a long-term policy for short-term relief. I support Chun-keung Plan's motion, and so I speak. Ms. Lam So-wai, I support the original motion and the 4 amendments. With an aging population, there is an increase in demand for dental services. There is a lack of medical services in Hong Kong, especially in dental health. There's only a short number of quota, and many people would rather pay in the private market other than wait for a long period of time. Under the Department of Health, there are over 40 dental clinics to provide services to civil servants and their families. Only 11 of them open up for general public sessions with 4,000 quotas per month. And this totally does not meet the demand of general public, and Thus, people would need to go to other districts to try to find quota. In Tai-o and Cheongju altogether, there is only 30,000 people, but in Sha-Tin and Chun-keung for 3 million people population there, we do not even see any dental clinic. And in Kwun-tong and To Kwa Wan, there are only 2 providing general public sessions. Do you think there is really enough quota? And these 11 clinics only open up 1 or 2 sessions per week, and sometimes it's only 1 morning or 1 afternoon. None of them provide whole day services, and they only provide pain relief service and tooth extraction, with the extraction being limited to 1 tooth only. There is also a shortage of dentists in the public sector. There are only 55 dentists in all these clinics. However, they will need to cater to around 160,000 people per year. Last year, we see a shortage of 15.7 in dentists. And this is really not ideal. We hope that the government would set up short-term, mid-term, and long-term goals. In the short run, there could be a dental voucher for the elderly with a minimum of $3,000 and to set up a maximum to $10,000. Currently, eligible elderly receive $2,000 in their elderly healthcare voucher with accumulation of up to $8,000. However, this has not followed inflation, and therefore the medical inflation from 8.2% in 2022 has increased to 8.8% in 2023. And for private sector, actually for pulp treatment, other treatment, it's actually $4,000 in fees, and together with scaling and polishing and dental checkup, $8,000 is totally not enough. You also need to pay for other expenses. The health care voucher is close to none under these circumstances. Therefore, there should be a dental voucher to provide support to the elderly and to receive dental service in the private market. In the midterm, in the 18 health centers, other than providing rehabilitation services, there should also be a provision of dental care. In the policy address, there is a mention of providing outreach programs in dental services, such as sending out outreach teams to elderly homes or to RCHEs, and to provide oral health checkup and simple fillings and scaling and polishing services. And of course, you should prioritize those who live alone. An outreach program should also be extended to areas in which there are no general public sessions offered. But first of all, we must first try to improve the situation of shortage manpower. Earlier, there are actually about 400 new dental graduates in the upcoming 5 years, but it can still not meet the demand. I hope that the government would set up policies, and that dentistry could also go under our basic health care. Dr. Teck Chi-yun. Last month in Caritas, a group of old people met with me to talk about the problems of elderly dental services. One of the representatives, an elderly surnamed Ko, spoke on behalf of the elderly on public dental services, and she wanted me to express her views. First, there are only 11 districts with dental services, only a small number of quota for general public. Many elderly would have to wait overnight. and even if they queue up early, they are not able to see a dentist. They hope that the government could extend the services so that the general public could also enjoy these public dental services. Secondly, the government suggested introducing non-local dentists. They are in full support of that. However, they hope that the qualifications framework could be set up clearly, such as introducing those from the Commonwealth countries. Third, as these would both take a period of time to realize, we hope that there could be contracted dental services to meet the immediate demand. And fourthly, there's an estimate of around 160,000 people who have left Hong Kong for good. So many of them students. So there should be a reduction in the demand for school dental care service, and we hope that these openings could be shared with the general public. I was gifted with this picture a few days ago by the elderly. This is actually a toothless tiger. They don't want to become toothless tigers. They hope that the government and the legislators will help them to fill up their teeth. And we hope that the government will not become a toothless tiger. These are the views of the elderly. And I hope that when you respond to our views, you would also respond to their demands as well. The elderly people did not enjoy basic dental services during young. Therefore, many elderly have dental problems. They think that toothache is actually worse than being sick. We really hope that they could enjoy healthy teeth and to enjoy a better life in their old age. There are 3 suggestions for the government. First of all, we must try to adjust supply and demand to provide services to those in need. And secondly, we hope that the budget could provide more dental services to the elderly. And thirdly, private-public partnership. There are actually dental services in the private market which the general public could not enjoy unless they pay a price. There should be more partnership so that the elderly can also enjoy such services. And I also speak in support of the original motion and the amendments.
Mr. Chow Siu-chung. Thank you, Madam Deputy. The shortage of public dental care services have long been criticized by many people. The previously announced healthcare professional manpower estimation report projects a medium to long-run manpower shortage in dentistry. Today, we have a serious shortage of dentists in Hong Kong. For every 10,000 population, there are only 3.7 dentists. It is a much lower ratio than many places. And also, the dentist industry is led by the private sector. Private dental care services are unaffordable. For those who can't afford it, they have to join the long queues waiting for a general public session. They have to endure the pain, and with the delay, they will miss out on the golden treatment opportunity. Because of the shortage of public dental care service quotas, many serving and retired civil servants cannot get the dental services promised. There are only 11 public dental clinics offering limited public services. They only offer the basic dental care packages like tooth extraction and pain relief, but still, there are many people queuing for them. The government should allocate a lot more resources to ramp up the supply of public dental care services, and also there should be more collaboration with the private sector so that needy people can get the services they need. Concerning And also, we should make sure that serving and retired civil servants can get the dental benefits they have. Now, there are 371 dental positions in the establishment, and there are a lot of vacancies to be filled. The government has difficulties to attract talents to the public sector. Still, we should allocate more resources to ramp up the training places for different dental professionals, including dental therapists and oral hygiene professionals and so on. And also, we should extend the functions of dental therapists so that with the supervision of a dentist, dental therapists can offer a wider range of services to the public. And also, we have to retain and attract talents in the dental profession. Now, there are fewer and fewer people joining the public sector. In year 2018, the percentage was 36%. In year 2020, the percentage has dropped to 26%. If we can't turn around the situation, well, no matter how many dentist trainees we have, we will not be able to compete with the private sector. We need 6 years to train a dentist. It is a long-term endeavor, but we have to address the short-term needs as well. To address the short-term need, we have to encourage a tripartite collaboration and triage needy patients. Say, for example, elderly people can use the elderly healthcare vouchers to gain access to private dental care services. However, the amount is only $2,000 per year, and dental surgery is very costly. Many elderly people would rather not pay out of their own pockets to get the service because it is simply unaffordable. Now, the government should consider establishing a dedicated dental care vouchers for elderly people to maintain good oral health. Now, the root issue is that we don't have a comprehensive public dental care system. Now, the school dental care service would stop short at secondary school. Under the CCF, we have the Elderly Dental Assistance Program for root canal treatment and scaling. But after that one-time assistance, you have to pay out of your own pocket. The government should meet the public's aspiration to have good oral health and also ensure sufficient services for serving and retired civil servants. I speak in support of all the motions. Mr. Holden Chow. Madam Deputy, first of all, I thank Mr. Ben Chan for moving this motion in relation to our dental service system. I also thank Madam Deputy to co-rise this proposal with Mr. Ben Chan. There are only 11 public dental clinics offering free general public sessions. Well, as many members have mentioned today, it is insufficient. Say, for example, in my constituency in Tuen the Yan-Oi Dental Clinic only offer one morning session for free consultation. There are so much competition that elderly people have to queue overnight. Last year, I paid a visit in the small hours. I talked to the elderly people waiting there to understand their plight. Oh, they told me the sufferings. Well, you may say there are elderly healthcare vouchers and also other programs to support them, but it's simply insufficient. The allowance is not exclusive and it's simply not enough. They were left with no choice but to queue overnight for a free public session. And also the range of service is really limited. That is extraction and pain alleviation. Well, since we have raised the concerns with the authority, the disc allocation system has been improved, so we don't see overnight queues anymore. Still, Secretary, we have to think about the root cause of the issue. We have always been asking to drastically increase the number of quotas of general public session, but the point is we don't have enough dentists. So this is what this motion is about. Now the government said it would consider allowing non-locally trained dentists to practice in Hong Kong without passing an examination. As mentioned in the proposal, there should be a requirement in place that these doctors have to serve for at least 5 years in the public dental care system. That is the medium-term solution to help resupply our talent. Well, what about short-term? In the short run, a quicker measure would be to issue a dedicated dental care vouchers for elderly people. Well, for elderly healthcare vouchers, the use is not dedicated. So we really need a dedicated healthcare vouchers for dental services. We know that the healthcare vouchers the amount of the healthcare vouchers have been increased by $500 yearly. But dental surgeries and other services are very costly. This new dedicated dental service vouchers is really necessary. Well, to save money, many elderly people would choose to receive dental care services in the mainland. So the future dedicated dental care vouchers should also be applicable for dental services in the mainland and the GBA. Now, about the number of dentists, for every 10,000 population, we only have 3.7 dentists. In Japan, there are 8. In South Korea, 5. We are obviously lagging behind the curve. So how can we significantly increase the supply of dentist manpower, especially in the public sector? Well, the government should reflect on why there is a lack of attractiveness in the public sector. Is it an attractive salary? Or is it because of the reduction in dental officers' positions in the establishments earlier on? That's why there is a lack of career mobility. If that's the case, we should offer more positions to them to offer a future to dentists. Thank you. Dr. So Chang-wing. Madam Deputy, a few months ago, media reports told us that grassroots people and elderly people braved the elements and waited for a free public dentist consultation session overnight. With our aging population, there will only be more and more service needs in the dental industry. Elderly people and grassroots people really rely on public healthcare services. At present, we are only offering them with the leftover quotas in dental clinics for civil servants. As mentioned in the motion, we have to formulate a 10-year development strategy to address the conflict. Now we have to reflect on the continuous wastage in the dental industry and think about how to plug the gap and resupply our talent pool. According to the WHO, a latest survey shows that in the US and Europe, the average dentist per population is 0.6 dentists per 1,000 population. As at mid-October 2022, in Hong Kong, we only had some 0.3 dentists per 1,000 population. In the Department of Health, over the past 3 years, there were 16.2% of wastage in the dental officer's grade. All these factors lead to a much lower dentist per population ratio compared with other advanced economies. The situation is especially dire in the public sector. The government should also drastically extend the network as well as the range of service and address the unduly long queues. There are only 11 public dental clinics offering free tooth extraction and pain alleviation services to the public. The service is really limited. The opening hours are very short. In the Hong Kong Island, there is only one public dental clinic in Kennedy Town offering free public services. It only opens on Monday and Friday mornings. For some other clinics, the service hours are even shorter. There is only half a day's service per week. The waiting time for a general checkup is 1 year. For root canal treatments and also tooth extraction, the longest wait can be over 3 years. There's a huge gap between demand and supply. I suggest the Health Bureau immediately formulates a short, medium, and long-term strategy to address the situation. Currently, the policy is to raise public awareness and offer only emergency services. The government should extend it drastically to pool the resources of the 18 DHCs to offer a much more comprehensive checkup and referral services for the people. Say, for example, the public-private partnership scheme should be extended to the public dental clinics. Checkups and other treatments should be covered by the public partnership schemes. And also, opening hours should be drastically extended. And also, the establishment of dentists in the public sector should be improved. There should be better promotion opportunities based on experience and capabilities, and there should be sufficient attractions for dentists. I so submit. Thank you.
Professor Chun-keung, Madam Deputy, I thank Mr. Ben Chen for moving the motion to comprehensively review and improve Hong Kong's dental service and manpower needs. Many people said that dental care is the province of the dental care or the dentists, but the TCM can deal with the trigeminal nerves and also dental toothache. We can take advantage of the TCM to deal with the dental problems, and we can achieve pretty good results. So we have the collaboration between Western and Chinese medicine to improve the oral health in Hong Kong. In terms of collaboration between Chinese medicine and Western dentistry, there is very little in the way of cooperation, but from Western experience, the collaboration between Western and Chinese medicine will go a long way to improving the oral health and lower the costs, and more people will be able to avail themselves of the services. As TCM is moving in the right direction, I think the government should consider incorporating the TCM practices into dentistry so that the oral health services would see the involvement of more professionals, and that would offer a wider range of options to the members of the public. I think the number of dentists and dental offices should be increased. The dentistry covers a broad spectrum with different specialist procedures, and the oral health and dental care are part and parcel of dental health. So the government should really optimize the manpower, in particular the dental therapists. They should be put to better use to supplement the lack of dental officers. Madam Deputy, as Mr. Ben Chen said in his original motion, there is a keen demand for dental services among the senior citizens, but they are deterred because of the exorbitant prices, and they suffer from dental problems, and they lose their teeth, and this is not only undermining the quality of life, but also their general health. So the healthcare voucher scheme and also the dental care programs should be a matter of a long-term commitment on the part of the government. With these words, I support the motion. Mr. Chun-keung, Madam Deputy, earlier there were media reports that there were long queues in the street for dental service in Hong Kong, and it says a lot about the keen demand for dental service. I support Mr. Ben Chen's motion. The primary healthcare has been developed for a long time. The government seems to be of the view that we should maintain the general health of the public to the exclusion of dental care. The medical health covers a broad spectrum of issues, and we are extending the preventative primary care, but the dental care has been given a short shrift over the years. Maybe the government is of the view that dental problems are not fatal and they're not providing the right level of service. In the early days in Hong Kong, we had a lot of unlicensed dentists, and they do enjoy high popularity until such time as the walled city was cleared. And people tend to use the services in the private sector a lot, but not everybody can afford it. Simple services like filling, extraction, and scaling would cost anything up to $1,000. It would be expensive even for the middle class, not to mention the grassroots people. I think the government should really revamp the original mindset. Dentistry is a necessity, and there should be right level of services to the public. And it's not easy because of the dearth of dentists. We have 3.7 dentists per 10,000 population. It is woefully inadequate. And we have 370 dentists in the public sector, and they're mainly catering for the civil servants, and only a handful of members of the public can avail themselves of the services. That's why people are queuing up overnight for the services. I think that the services should be improved. The other direction is PPP. We have 2,700 dentists. Most of them are in the private sector. The healthcare voucher can be used for dental care, although this is not sufficient. I think the government should issue the dental vouchers to subsidize the dental care in the private sector. Because of the dearth of dentists, we don't really have enough manpower to go around. I think the government should distribute the vouchers for people to seek dental attention in the GBA. Now, people need to have dental implant and other care, and it is very much a new trend for people to visit the GBA for their dental needs. Thank you. Mr. Ronick Chen, Madam Deputy. However, concern one is about their teeth. People are bound to suffer from certain dental problems when they are aging, and the need for dental services is bound to creep up as time goes by. the dental decay is undermining the quality of life. The public dental services are providing services with a waiting time of 12 months or more. For root canal operation, it would be anything up to 39 months. And this is really not good enough. In September last year, many members said that in 6 clinics, the government would register the patients to offer it in need for them to queue up overnight, but this is very ineffective, and people would have to register again, and those who are denied the chance would have to queue up once again. Why is it that people will have to go to all this trouble for the fundamental services? Now, Hong Kong prides itself as a smart city. Why do we need overnight queuing? Why not telephone booking or online booking instead? The government has rolled out the assistance program for dental care and also the healthcare voucher scheme to subsidize the dental care for the elderly, but the amount is nowhere near enough to pay for the expensive private dental care. For those who have visited the private clinic who understand that prior to the operation, an X-ray would cost anything up to a few hundred to $1,000. Now, the $2,000 would be enough to meet the fees for only one single visit or 1.5 visit. The government is going to set up a working group on oral health and dental care, and a review would be undertaken to make sure that people would have high-quality dental service. I think this is a step in the right direction, and this is well worth supporting. But by the end of last year, we said that we have 2,700 registered dentists. I mean, we have different ratio per one compared with 30 advanced jurisdictions. We are third from the bottom. In the UK, the dental care is provided in the healthcare service, and all low-income people would be able to get the lion's share of subsidy. But in Hong Kong, the services are mainly made available in the private sector. 90% of the dentists are in the private sector. For the public sector, as we said many times, and main recipients are the civil servants. And for the 11 clinics, they have 1 or 2 half-day service. They distribute 400 or so discs per week. So this says a lot about the quality, the level of services provided by the public sector. We are in a leading position in terms of dentistry. Our dentists are really ranking top in the world. But I mean, we are lagging really far behind other jurisdictions. The government said that the places will be increased to 90 in dentistry, but it would take anything up to 6 years to train up a dentist. The government should come up with a specific timetable to review the manpower situation, maybe a midterm review every 5 years and a major review every 10 years. And they should introduce non-locally trained dentists to plug the gap. There should also be PPP to meet the demand arising from the dental problems. I am truly grateful to Mr. Ben Chen for moving this motion to urge the administration to review and improve the dental service and manpower needs. And I support all the other amendments. Thank you very much.
Mr. Chen Pui-le. Oral health is essential to a person's living standard. Many elderly are not able to have a proper diet intake because of unhealthy teeth. However, due to a shortage of manpower and a lack of quotas for general public sessions, the grassroots and many of them elderly would need to queue up overnight for dental services. Therefore, there is a need to review dental services to come up with new measures. Currently, there are around 2,700 registered dentists, so it's around 3.7 dentists per 10,000 people, which is much lower than the mainland and Singapore. Although there would be an increase in the training places for dentistry, since training takes 6 years, there is actually no means of alleviating the shortage within a short period of time. The government is looking into the introduction of overseas dentists. According to the latest numbers at HA, there are only 5 eligible dentists so far. So can this really alleviate the shortage of manpower? Currently, in the government, out of the 300 establishments, there is a shortage of 50. In the short run, therefore, the government should try to leverage the services of dental therapists and surgery assistants. They actually play a very important role in dentistry and can provide services pre and post dental treatments. It is not as difficult to become a dental assistant as the wait for public dental services is long. A private-public partnership would be much needed, and this is actually the most imminent solution. Currently, what we lack most is elderly public dental services. However, with only $2,000 in the elderly health voucher, it is not enough for them to cover dental services as well. Can the government consider providing vouchers that can extend to dental services and then extend the coverage to the vulnerable and also to those with disabilities, and perhaps to contract out services so that those in need will be able to enjoy dental healthcare services for those who are unable to afford them. Earlier on, under the program by the government of providing mobile dental services, they're actually much welcome by the elderly, but due to the completion of the contract, this program was suspended. Mobile dental services can provide pain alleviation and scaling and also basic services. General public sessions only provide tooth extraction and pain relief treatment. We must ensure that we can satisfy the needs of the general public. Children dental services should also be included. Currently, the school dental care service does not include those under primary age, and many cavities are actually seen in those under 5. We must ensure that these pre-primary students can also enjoy dental services so as to better prevent cavities. I speak in support of Chen Han-peng's original motion and the other amendments. Mrs. Regina Ip. I speak in thanks to Chen Han-peng for raising his original motion to comprehensively review and improve Hong Kong's dental service system and manpower needs. I also support the amendments other than that by Chen Hoi-yan. I also understand that toothache is worse than huge sickness. There is a shortage in manpower, and with the aging population, there is more imminent need for dental services for the elderly. After listening to my colleague speak, and after listening to the secretary, it seems there is no immediate solution. Hong Kong lacks dentists and dental therapists. As many of my colleagues have pointed out, we only have about 2,651 dentists out of 7 million population and only 497 dental therapists, which is a huge shortage. According to the government's report on the health manpower estimate, the shortage can only be met by 2045. It takes 6 years to train up a dentist, a dental therapist 2 years. So this is not something that can be resolved in the short term. Even if the government is willing to earmark more resources, we will still need to identify venues and to have enough teachers and instructors. I heard that HKU is looking into building an experimental lab in Pak Fu Lam, and they will need to build this on a green area, which has been objected by the public or by those living nearby. I have reservations on Chen Hoi-yan's amendment on providing a dental voucher, because the health vouchers can already be spent on dental services, and that our recurrent expenses have been huge. In the past 5 years, social welfare, education, and health services since 2017 to 18 have doubled. And these constitute about 60% of our recurrent expenses. And I think there's an increase of 40% in health services. Our reserves from peak times in 2018 over 1.1 trillion now has now decreased to 800 billion. We must ensure healthy reserves, and therefore I object to increasing our recurrent expenses, to expand coverage to dental care vouchers and other social welfare services. In order to meet the demand, we must try to enhance manpower, and we should allow more overseas dentists to practice in Hong Kong. I remember in the past, other than Commonwealth dentists, there are also dentists from the Philippines. Since we see a huge shortage of manpower, we should relax the restrictions and to attract more power into Hong Kong. I support the original motion and the amendments by other colleagues. I just have reservations on Chen Hoi-yan's amendment. Thank you. Ms. Nixie Lam. Thank you. I speak in support of Chen Hanpen's original motion. Our toothache is much worse than sickness. I'm sure that many of you have experienced it. Oral health is very important. If you do not own oral health, it affects diet intake and also affects your standard of living. Although in Hong Kong, we have the top-ranking dental college and also the best dentist, the public dental services in Hong Kong is in huge shortage. We have 40 public dental clinics in Hong Kong, but they mostly provide service to civil servants, retired civil servants, and their families. Only 11 of them open up 1 or 2 sessions per week to the general public and provide only acute services such as tooth extraction and treatment of pain relief. Therefore, the general public can only seek services in the private market. And fees are quite exorbitant in the private market. Even if the elderly has health voucher, teeth implant and dentures cost tens of thousands of dollars, and $2,000 of elderly healthcare voucher is really inadequate to meet those needs. There are also other vulnerable groups that have been neglected. Those with intellectual disabilities are some of them are not able to brush their own teeth properly, and so you see gum diseases and cavities, and they're also very sensitive to the dental equipment when they're in use. Therefore, it is not easy for them to seek suitable dental services. I visited a clinic in Hoi-yan last year, and they're actually part of the Health Teeth Collaboration Program, providing oral health education. But currently, only 5 organizations have joined such collaboration. I suggest the government enhance the quota and also do more promotion so that more people could benefit from this collaboration. I also suggest that training be open up to dentists so that dentists can also learn how to treat those with intellectual disabilities. Although the level of dentistry in Hong Kong is very high, however, there are only about 2,700 registered dentists in Hong Kong, and only 300 of them are actually in special dentistry. And compared to 5 dentists for every 10,000 people elsewhere, we actually lag behind with only 3.7 per 10,000. In the 2020 to 2023 to 2024 to 2025 academic year, the government has increased the training places in dentistry from 80 per cohort to 90 per cohort. So that is actually a small step towards improvement. However, the shortage of dentists would remain in the short to medium term because the training up of dentists takes 6 years. So it would be 6 years later before we can see dental graduates. In order to resolve this situation, I suggest that we should also try to set up time-limited dentistry services and to introduce talents to come into Hong Kong to work in this area so as to expand the services. The government must also enhance training and also to hire more dental therapists and to actually transfer scaling and polishing work to therapists so that dentists can treat more acute and professional problems. In the long run, the government must also ensure that by using the health centers to try to expand the scope to all 18 districts, and to ensure that we can do more in terms of prevention to ensure oral healthy habits in Hong Kong.
Dr. Lo Wai Kwok. Madam Deputy, I thank Mr. Ben Chan for moving the original motion and the amendments moved by the 4 other members. Today is the first council meeting in year 2023. I woke up early in the morning and bake some homemade char siu for our members. I think all members enjoyed my cooking. Well, I always say that while we still have teeth, we should enjoy these local gourmet. Well, dental health is very important. With bad teeth, it would affect your appetite and hence your health. Well, because of our lack of dentists, The public dental services are always in shortage. And because of the costly services, many people choose not to scale their tooth and do checkups. As a result, their oral health deteriorates. And with our aging population, the supply shortage will continue to worsen. I and the BPA agree with the main points mentioned in the motion that we should establish a 10-year development strategy for dental services and establish short, medium, and long-term solutions to address the service needs. Mr. John Lee, in his first policy address, mentioned that the primary healthcare blueprints would be delivered and DHCs would become the key service locations for offering primary healthcare as well as dental care services. And also a working group on reviewing dental services would be established to advise the governments on how to enhance the service model. Well, I suggest that we make use of this opportunity and also make reference to the oral health survey 2022 carried out by the Department of Health to establish short, medium, long-run strategies and chart the direction and set a practicable timetable and roadmap so that more quality dental services can be provided to members of the public under the public and private and also collaborated model. We have to take a multi-pronged approach and take forward targeted efforts. In the short run, we should review the primary dental service network. There are only 11 public dental clinics in Hong Kong. They are distributed unevenly in terms of geography, and also their opening hours are erratic. We should deploy mobile dental service vans to all 18 districts so that people who are immobile don't have to cross to other districts to receive service. And also we should make use of DHCs and DHCs Express to offer dental checks for the public and encourage them to seek help. And also we should better utilize the private sector in offering dental services. Now, because of the costly services, we should roll out dental care vouchers to help those with lesser financial means. In the long run, we have to increase the supply of dental manpower. We should combine our dental, the strength of our dental schools and our hardware to increase the supply of talents. And also, while protecting the benefits of locally trained dentists, we should consider introducing non-locally trained dentists who are qualified. We should extract Hong Kong residents who are dental experts practicing overseas to serve Hong Kong people. In the long run, we should also integrate into the GBA development. While many Hong Kong people are choosing to live and retire in the GBA cities, we should encourage more collaboration in terms of dental services across the boundary and allow application of healthcare vouchers across the two places. Thank you. I support the motion and all the amendments. Thank you. Mr. Tommy Chang. Madam Deputy. Now, oral health is of utmost importance. Like Dr. Low said, elderly people who have no teeth would suffer a lot. Prevention is always better than treatment. However, because of the prohibitive cost, many people would delay seeking assistance and they would only take painkillers. For elderly people, they don't have teeth, so they can't chew solid food. They can't even eat fish balls. And in the end, it causes malnutrition. All along, we have a serious shortage of dentists. when I was still a kid. I don't think Madam Deputy was born yet. We had dentists from the Philippines and also from Taiwan. Now we are increasing the number of dentists at a snail's pace. It is lagging far behind the increase in population. The supply-demand gap is ever widening. It drove up prices. As a result, dental care costs an astronomical sum. Say, for example, a scaling costs $1,000 for dental. It costs $10,000 per tooth. And for other services, it can even cost $20,000. According to the WHO standards, in industrialized countries, the standard ratio between dentists and population should be 1 dentist per 1,000 people. Or in our country, the dentist per population ratio is higher than that. In Hong Kong, however, there are only 0.3 dentists per 10,000 people. We are short of 1,400 dentists in Hong Kong. Now, according to the the Dental Council, we have 2,400 dentists and also 310 dental specialists. Well, given the size of our population, the amount is too small. So we need to take a two-pronged approach. We have to introduce non-locally trained dentists to Hong Kong. On the other hand, we have to help the public to build a habit to protect their oral health. This is down to education and publicity. On my first suggestion, the Dental Council in Hong Kong in year 2015 suggested that the recruitment of non-locally trained dentists should be increased to 2 sittings per year. And also, examination requirements should be relaxed. However, the result is not significant. I suggest we increase the number of sittings per year to 3 to 4 times per year, and also extend the source countries of candidates to places farther away. In the 2022 policy address, the CE suggested opening up new pathway for non-locally trained doctors to come serve in Hong Kong. The Health Bureau has been consulting the stakeholders concerning the plan. Well, with this promise made by the government, I ask the government introduce a bill to the legislature this year. Now we have 50 dentists position to be filled in the establishment, and there are a lot of there is a huge shortage in the public dental service system. I think we should make the system more attractive to dentists, and also we have to enhance oral health awareness among grassroots people. Now this is all about having the basic knowledge on how to protect your oral health. And we shouldn't neglect our domestic helpers as well. Many source countries of our foreign domestic helpers do not have good oral health education campaign. And also, in the short run, we should offer an allowance for elderly people to fix the teeth. Time's up. Dr. Priscilla Leung. Madam Deputy. Now, no one wants to suffer from tooth pain. Early treatment is important, but it really costs a lot. If you are in so much pain, sometimes you would rather your tooth be extracted. But even that may be unaffordable. Over the past 8 years, during every policy address and budget debate, I put forward an idea that is the 18th District Mobile Dental Service van. When I was a kid, I was born in a grassroots family. we had mobile healthcare vans visiting our neighborhood, and everyone could get free medical services. Well, in my constituency, that is Kowloon West, over the past 8 years in Sham Shui Po, the Zhang area, where there are a lot of elderly singletons. Well, the location is very remote. There is no clinic. Now in Kai Tak and Fucheng, we have also conducted a trial of mobile healthcare vans, which is very popular. Now the Kwai Chung District Council has allocated $70 million to deploy 2 mobile dental service vans. Many people were benefited from the van. However, the Yanchai Hospital decided to cut the service because of a lack of funding. Now we have been collaborating with an association to deploy a dentist van. Each van would cost $3.5 to $4 million per year, and 3,000 patients can be served. Well, I have seen it with my own eyes. Children can get dental checkups, tooth extraction and scaling service. This is a one-stop service, and it is also very popular among elderly people. Well, actually, the dental schools have told us that they are very eager to join the scheme. They would be willing to offer mobile dental services on vans to the 18 districts at a very reasonable price. If there is a mobile dental service van in each district, it would be equivalent to 1.5 dental clinic for each district. It is some $800 million per district. For 2 vans, it will cost $1.6 billion. Now you have to pay $10 to $20 per session, but the patients will be happy. My point is, it is simply impossible to ask the dentist to offer their services for free. I know that. Well, back in when I was young, I had many friends who were dental school graduates. Well, it's not always that they would be seeing patients. So they are actually very eager to give back to society. But I don't think that the government has a comprehensive plan in this regard. At some point, some people criticize that we have an oversupply of dentists. I'm glad that my friends are still staying in the field. Now, my idea, it will cost $1.6 billion. It is really beneficial. I'm fine with whatever plan to introduce overseas talents. But why can't we make use of our local talents? Well, with our local talents, the insurance company would be more open to the idea and support the idea of mobile dental van. There can be a van nearby your home. So this would be music to the ears of the grassroots. Now, previously, Professor Chen was too busy in fighting the epidemic. I hope Professor Low would accept my idea, and everyone would be thankful to you. Thank you.
黎棟國議員。
Stella Chong-kwok, Madam Deputy, there is a serious shortage of dental care in Hong Kong, and this is playing for everybody. Now let me come back to the original intention. The Medical Development Council has already laid down the oral health target to be achieved by 2025. And all these targets that were subscribed to by the then administration, and they have put in place the plans. the plan has been in place for so many years, but according to 2017 Director of Audit report number 68 in 2010, a lot of the targets fell by the wayside, like the target of tooth decay free target. It was 70%, but the target achieved was only 49%. The tooth decay free for 46-year-old or below, it is falling short of target. So from 2011 to today, one would expect some improvement. But in 2017, in answer to the direct audit, the department said that because of the changes in circumstances, the target set so many years ago do not make much sense. I think this kind of response is nothing short of ridiculous. If the target is too outdated, we can bring this up to date instead of doing virtually nothing over the years. And when questioned, they said the circumstances have changed and it is water under the bridge. It's this kind of response and indication that between 1991 and now, the government has done virtually nothing. Now, the direct audit may serve a reminder on the government about this target being unmet. We've been waiting for so many years after the direct audit report. Has the government done anything to update the target? In 2019, the government set up an expert panel to review and put in place more appropriate oral health target. But have we heard anything since? I've drawn a blank from the administration and look forward to some reply. The target is a motivating force. Without any target, we are rudderless. We will not be going anywhere. So I think the government should really set a clear target for dental care in Hong Kong. I hope that the administration would review the dental service system and come up with some clear targets for us to improve the well-being of the citizens. I wouldn't say that there is inaction on the part of the government. The number of graduates has increased from 50 in early days to 90, more like doubled. But at the same time, the dental services are falling short of needs. Now we have 371 dentists in the government sector. There is a vacancy of 58, and that's why we've seen people queuing overnight for the dental appointment. And this is the last thing we'd like to see happen ever again. So the Health Bureau is seeking to introduce qualified non-locally trained doctors. We pin very high hope on this scheme, and I look forward to the bill to be introduced to the council sooner rather than later. I'm wondering whether the government should make sure that the non-locally trained dentists would serve for the government for some time before leaving for the private sector. Madam Deputy, the civil servants are also suffering. There is a long-term shortage of service. Waiting time is getting ever longer. Scaling, it would take 1.5 years, and the appointments are shifting all the time. The NPP made the recommendation earlier that the government should take out insurance for the civil servants, or at least they should subsidize the insurance premium so the civil servants can seek dental service from the private sector. So I speak. Mr. Edward Leung. Madam Deputy, I rise to speak in support of the motion and the amendments. I support all these ideas. There is a serious shortage of dental care. There are 11 dental clinics providing public dental services. In particular, many elderly people are queuing for the service. In Hong Kong East, where I serve, there is not a single one. There is one on Hong Kong Island that's in Kennedy Town, but it's open in the morning of Mondays and Fridays, and people will have to queue up for the service. Many senior citizens are telling me that they have to queue up at the crack of dawn, and if they fail, they will have to queue up all over again. I mean, toothache is more serious than other illnesses. Maybe paracetamol will not be the answer to the problem, and they are hanging in the balance. They find it difficult to make an appointment. So this is very much a headache for the general public. The WHO has a target, 80-20. It means that by 80, we hope that the senior citizens will have 20 healthy teeth in their mouth. But if I ask the officials to take a look at the general public dental services, that these, I would challenge you to tell me that the 80-year-olds that don't even have 20 healthy teeth. So can the elderly people have a dignified life in their twilight years? If senior citizens are suffering from dental problems and they end up being a dentalist, then it certainly would compromise their old life. Some say that technology is really good these days, and people can fix the false teeth. I'm sure that those who say this would be young people or the businessmen in the dental business. The real teeth, I said, would be far better than false teeth. Now, this is something that we're born with, that we don't have to pay for them. So as a responsible government, we have to help the elderly people to look after their own health. And this is an inshakable responsibility. So from that perspective, the government has a lot to answer for. So the DAB urges the government to designate a $2,000 dental voucher scheme so that they don't have to queue up for the dental service in the public sector, and there is not enough service to meet the demand. And I'm sure that if we can take full advantage of the private sector, we can certainly make available the basic services like scaling and filling, and that would make sure that they will not lose their teeth. And this is a designated scheme specifically for the senior citizens. It will not be used for any other purposes. Furthermore, the administration should fully review the long waiting time for dental appointment. I know that the government has put in place some measures. They put in place some measures to avoid overnight queuing, but they are making some difference to the queuing arrangement. The quota still remains pretty much the same, and the senior citizens will have to wait for an awful long time for the meager services. So the government should consider how best they can increase the quota so that the old people will stand to benefit. President, I'm sure that anyone who suffered from dental decay or toothache would agree that toothache is really worse than being taken seriously ill. I hope that the government would restore a good set of teeth for the senior citizens. Ms. Doreen Kong. The teeth are an indication of health for the senior citizens. The dental health would have everything to do with the quality of life. And our day-to-day interaction with people, we are affected by the dental health. Serious dental problem would affect a lifespan. 1/3 of the adults between 35 and 44 do suffer from tooth decay to different extents. It shows that the dental care is woefully inadequate in Hong Kong. I think we have to look at the development in Hong Kong. There is a shortage in the public sector. This is a perennial problem. For the grassroots people, they would avoid going to the dentist because of the exorbitant fees, and the problem would worsen and worsen. The major problem attributes to the fact that there is a shortage of dental care from the public sector, and people will have to go to the private sector for the dental care. For the grassroots, the fees and charges in the private sector are really too expensive for them. It's beyond their affordability. There is another problem of a lack of dental care development. There is a lack of funding. There is a lack of coordination. And these are the contributing factors causing the collapse of many of the services. And over the past 3 years, statistics show that the DH has lost a total of 64 dentists. The vacancy rate is 16%. The mass exodus of dentists from the public sector is limiting the development of dental care. I think the government should come up with a more flexible policy to make up for the shortfall. The government has done something about the registration system, but to limited effect. Over the past 10 years, statistics show that those who get registered, the number stands between 3 and 27, and this is nowhere near meeting the demand. There is only one university offering dentistry, and there is only one institution offering training for dental therapists. And there is not enough newcomers to make up for the shortfall, and this is worrying. In the US, the dental care is improving. In Germany, the number of dentists 50% of the number of doctors. In Hathaway, they have 100 dental clinics to serve the population. Dental care has become an industry in Germany. And they have 20 or so clinics providing dental care. And in Germany, they are making people undergo dental checkup every single year. They're covered by insurance. In the region, there is the coordinated services. In Singapore, they have the social insurance protection, and there is specific clinic provided. In Taiwan, they have introduced the oral health legislation to promote oral health. In Japan, for certain age brackets, they do have specific targets. So oral health is not a problem that happens overnight. It is built up over the years because of undesirable oral health habits. So prevention is always better than cure. We rely so much on cure instead of prevention. And more importantly, I think we should really tackle the oral health. We have to come up with long-term strategies and consolidate all the resources and make available the resources to protect the oral health of the general public. Thank you.
Mr. Chan Hak-kan. President, I believe that everyone deserves a set of healthy teeth, and every person should enjoy basic dental services. Many grassroots, especially those retired, think that dental services are very expensive and they would not go for regular checkup and regular scaling. Therefore, their teeth deteriorate. Although the government would say there is the elderly health care voucher and also dental clinics, we understand that a visit to the dentist is exorbitant and you might have to use almost all of your health care vouchers. And even if you have accumulated vouchers, you would still use them all up. Rather than to pay for dental implants, why can't we support the elderly or members of the public to enjoy basic dental care services or regular checkups and scaling to prevent dental diseases? Currently, the healthcare policy does not place enough importance to gum diseases. Although we do have the highest life expectancy amongst the world, we still need to enjoy a good standard of living. In Hong Kong, about 30% people live under poverty, and many of those elderly actually suffer from gum diseases and many other dental problems. Out of the 30%, only 30% of those receive regular dental checkups. You would thus understand why people would not go for regular checkups. That is because of their high cost. The elderly already finds it difficult to support basic living. Dental service actually to them seems like a luxury. For every 18 non-RCHE resident, there is one who has lost all their teeth. And almost all of those who do not live in RCHE suffer from dental diseases or gum diseases. Therefore, this situation is very serious in grassroots, especially the elderly. We should not solely rely on the private sector. Although the Department of Health offers basic dental services in public sessions, they're only limited to acute services such as treatment of pain relief, also to treatment of oral abscess and teeth extraction. And there is only limited public sessions. It is actually not comparable to the population number. Recently, I heard that there is a very long waiting time for dental services, and it is not realistic to have the elderly wait and queue up for these general public sessions. I have always requested for long-term dental services. I think I've spoken about this for over 10 years. And finally, I see the light at the end of a tunnel that our chief executive has suggested a strategy for dental services. This is happy news for the public. However, I would like to take this opportunity to request the government to incorporate dental services into our regular medical services, and that mobile services be provided to those in need. We should also increase dental vouchers, the number of quotas in the general public sessions, and of course the training of more manpower to meet the shortage of dental services. I support Chen Hanfan's motion and all the amendments. Ms. Judy Chen. Thank you, President. Teeth is very important for us to chew our food properly. So when we suffer from dental problems, it affects not only our teeth and gums, but also our entire physical health. It also affects the mental health of many people as well. Therefore, we should try to ensure that everyone enjoys a healthy living, and therefore I support the motion by Chen Hanfan to review Hong Kong's dental service system. The chief executive, Mr. John Lee, in a visit of one of the clinics, once again reiterated his determination in formulating a strategy for dental services. Prevention is much better than cure. other than providing awareness in oral health habits, the public dental services in Hong Kong have never really been adequate to meet the demands of the public. Therefore, setting up a division to look into oral health is something welcome by everyone in Hong Kong. We need strong teeth to help us with a proper diet intake. According to the Dental Association, according to statistics from last year, we have 2,506 registered local dentists and 237 overseas dentists. So altogether, there is 2,779 dentists in total in Hong Kong. If we look at our population, it means that for every 10,000 population, there's only 3.7 dentists, which is hugely inadequate as compared to other countries. And this is the reason why people find it so difficult to secure public dental services. People usually try to bear the pain of toothache until they could bear it no longer and visit a private clinic. But then prices can be very high and they would need to pay exorbitant fees to treat those problems, and therefore this is not an ideal long-term strategy. Looking at the demographics, we're going to move into a very aged population, and there is imminent need to enhance our dental services. Many of the dental graduates would go into the private sector instead of providing public services. There is a long-term shortage in manpower in our public services. According to the WHO, those above the age of 80 should own 20 functional teeth to reach this 80-20 ratio. Well, that of course does not include dentures. Currently, I don't think our population can meet this 80-20 target. I hope that the government can make this a goal and to provide enough support to cover dental services in our regular medical services and to introduce more manpower to meet the demands of our society and to provide adequate dental services to the general public. Thank you. Mr. Lee. President, first of all, I'd like to thank Chen Han-pen for moving the original motion of comprehensively reviewing and improving Hong Kong's dental service system and manpower needs to comprehensively reviewing and improving the system and enhancing manpower needs is very important, and I'm happy to hear that many of the colleagues support this motion. Chen Han-pen and I myself, on behalf of DAB, has also come up with a draft on a blueprint for dental services development in the future. So this is only a first draft. I hope that we will continue to improve our blueprint and submit it to the government to win your support. I hope to see this mentioned in the budget or maybe in the next policy address. One of the goals mentioned in this advocate is to formulate a 10-year development strategy and blueprint for dental services. We have been trying to fight for this for over 10 years. 10 years is quite a long time. We actually has not seen much improvement in the dental services in the past decade. The only improvement is the community care fund, in which the elderly can enjoy dental assistance. But this is not adequate to meet the needs of the elderly because this is only a one-off assistance. Now all the bureaus are coming up with blueprints. We have innovation and technology blueprint, the blueprint for youth development. I hope that under the leadership of the secretary, you can pledge to also set up a 10-year dental service blueprint. We are trying to be pragmatic. We understand that in the short term, due to the shortage of manpower and consideration of resources, we cannot actually just achieve our goal in one go. We hope to take this step by step so that the general public can see some sort of improvement. I hope the secretary can also relay this to the financial secretary. We are looking into a dental care voucher for the elderly of around $2,000. During inclement weather, when the news report the elderly people queuing up outdoors for a quota, it is very sad and pathetic. We should set a designated voucher for dental service, and that it be applicable to government clinics. And this can help the elderly find a solution in the short term. In the long term, we must enhance training and increase manpower. By going forward step by step, we hope to review the system and improve our dental services. In the short term, we must try to work on prevention. As Dr. Low said, cure is already too late. Prevention works wonders. We must do more in terms of prevention. The best program so far is the school dental care service, yet the elderly are the ones most in need of dental services. Even if we talk about floss, many of the elderly do not know how to use it. If you teach them how to floss their teeth properly, I'm sure it can improve their oral health. We should send out ambassadors to elderly centers to share with them what can be done to have dental health, or to send out mobile teams to them to teach them about oral health.
Mr. Stanley Lee. Thank you, President. Concerning the motion comprehensively reviewing and improving Hong Kong's dental service system and manpower needs, I support it and I support all the amendments. I'm thankful to Mr. Ben Chan for moving this motion so that we can pull our thoughts. We all know that bad dental health can be excruciating. It would affect our diet and health. Now, my constituents always told me about the difficulties in accessing dental care. Private sector dental care is expensive. Many people cannot afford private dental services. They have to join the queue for public dental services. Now the wait is very long. For an ordinary checkup, the wait is 12 to 18 months. For follow-up treatments like root canal treatments or tooth filling, that is another 19 months. The issue boils down to lack of supply and also prohibitive cost. Now, under the CCF, we have an elderly dental assistance program. For CSSA recipients, we have the dental grant. Well, referring to the electrical's information, as at March 2022, there were only 93,000 people benefiting under the elderly dental assistance program. There are some 1.45 million elderly people in Hong Kong. Many of them have dental problems because of the lack of oral health awareness and also the prohibitive price and cost in the private dental sector. Some elderly people have to endure it, and also some working poor cannot afford dental services as well. With limited help from the government, they can only endure the pain. So I support the motion. There should be a blueprint for dental services development in the next 10 years. Without adding to the financial burden to the patients, they should be able to enjoy quality dental healthcare services. Now, in the short run, I support the idea of establishing the $2,000 dedicated dental care vouchers, which can be applied across the border. Elderly people who want to save money can have access to dental care services using the dedicated dental care vouchers. Since the government and the Central People's Government are promoting the strategy of integration with the GBA, we should give full play to the rich medical resources in the GBA to help alleviate our pressure. Say, for example, we should consider extending the usage of our healthcare vouchers to grade 3A hospitals in the GBA, for example, Shenzhen Municipal People's Hospital. They have dental clinics offering tooth extraction, tooth filling, and also orthodontics services. For these advanced dental surgery services, they are available. However, at present, the healthcare vouchers is only applicable to the Hong Kong University Shenzhen Hospital. And there are only so many patients that one hospital can serve. So the government really has to pick up pace to meet the people's needs. And second, we should continue to promote public-private partnership. The policy address stated clearly that we have to shift the focus to prevention and promote primary health care. The purpose is to alleviate the pressure of our public healthcare system and triage needy patients to the private healthcare system. Now, on the public-private partnership model, patients should be subsidized to receive dental care in private dental clinics. It will help cut the waiting time for public services. In the medium to long run, we should streamline the mechanism to introduce non-locally trained dentists. Now, since 1997, every year, only 3 to 27 dentists would have passed the yearly examination hosted by the Dental Council in Hong Kong. And recently, we have seen lots of wastage in the dental trade. Although the government has ramped up the number of training places each year, it is still insufficient. I think the government should really rise up to meet people's needs and alleviate people's pain in waiting. Thank you.
Ms. Elizabeth Quat. President, I speak in support of Mr. Ben Chan's motion debate on comprehensively reviewing and improving Hong Kong's dental service system and manpower needs, as well as the amendments. In August last year, we saw from the news quite frequently that a lot of grassroots as well as elderly people had to wait and queue outside dental clinics. They even had to do it overnight just to get a slot. And this happens in a lot of places, say in Chun Wan. These people waited for hours on end just to try to save a bit of money and have their teeth seen to. Hong Kong is an affluent society, yet we see this phenomenon. It breaks our heart. With an aging population, the demand for elderly dental care service has been increasing. But public sector service provision is seriously inadequate. For every 10,000 people, we only have about 357 dentists, which is a lot lower than other places. There is a serious shortage of manpower. The 40 outpatient dental clinics under the Department of Health only serve civil servants. Only 11 of them open to the public for about 4,000 quotas. So elderly people queue and waited for a slot. But in the end, only tooth extraction and pain elevation services are available. They will only extract one tooth. They don't do filling. They don't do any other service. And if you have more than one teeth to be extracted, you will have to queue again. That is grossly unreasonable. I know a lot of elderly people from grassroots families have never seen a dentist. And to a lot of people, dental care is something that they are alien to. They don't have time to queue for a dental clinic place. They don't have time to go elsewhere, and they don't have the money to seek private attention. In 2016, elderly people from low-income groups, 3/4 of them have never seen a dentist. About 90% of them have not been receiving regular checkup. The reason why elderly people don't go see dentists is because it's too expensive. For scaling, it costs hundreds to 1,000. For other services, it easily costs $10,000, and there is very little subsidy from the government. It would be better if you are on CSSA, but not many people are on CSSA. Back in 2013, I asked the government to expand public dental service. 2019, I asked a question seeking oral answer about dental service improvement. However, the replies I have been receiving fall short of anything that is satisfactory. Last week, the DAB announced a proposal on dental service improvement. We have suggested some short-term measures. We think that there should be 2,000 dedicated dental service voucher that can be used across the border. And there should be more places for training dentists, and there should be flexibility in allowing non-locally trained dentists to practice here. And for dental therapists and assistants, the establishment should be expanded. Public dental service should be a regular service, serving as a safety net for those in need. Mr. Ben Chen proposed a mobile dental service vehicle. It's a very good idea. We dread toothache. We see elderly people without any teeth. They can't eat properly, and it depresses them. So I ask government to pay more attention to the needs of elderly people. They should hear us and amend the law as soon as possible. Mr. Tan Yue Heng. Thank you, President. In Hong Kong, we have a serious inadequate manpower as well as a service provision in Hong Kong. There is imbalance between supply and demand. It's very difficult for people to get the service, and then the service is expensive. Please remove your mobile phone. In April last year, in relation to dental service, I asked a written question. A number of members have also asked similar questions here. So it's very clear that dental service has drawn public attention. I thank Mr. Ben Chan for moving the motion so that we have another chance to focus our attention on this debate. In relation to dental service, the main service supply is on the private sector. There is also emergency service. Grassroots find it difficult to have access to the service. The crux of the problem is a serious manpower shortage, especially in the public sector. A number of members have made similar remarks. If no concrete measure is taken, there is no solution to be found. It makes us more concerned whether the increasing demand from an aging population can be resolved. I ask the government to put in place comprehensive plans to improve dental service. I have some suggestions. First, there will be about 400 graduates for dental service in the coming 5 years, but that is seriously inadequate. There should be other measures put in place to resolve the problem. There is a demand for emergency dental service. If they can find a solution, it should be implemented. Eligible institutions should be allowed to provide service even if they are in the Greater Bay Area. Well, for Department of Health, there is only emergency service in the form of tooth extraction and pain relief available for the general public. These dental hygienists should provide more services to meet service demand. In the medium term, non-locally trained dentists should be allowed to practice under the limited registration regime. As long as the reputation and service quality is kept, the use of non-locally trained dentists should be allowed. The government should put in place good licensing regime and supervision regime. I heard that there will be new pathways introduced to introduce non-locally trained dentists. Once they have the details, please consult the public. I hope that we'll be able to see details soon. In terms of competing for talents, yes, we can attract them to come to Hong Kong. At the same time, we should train local talents. The government should also look into the term of employment, trying to retain talent. We have a serious shortage in dental practitioners. After extensive consultation, I asked the government to put in place focused measures to address the issue. I ask members to support Mr. Chan's motion. Mr. Kwok Wai-Keung, I speak to support the original motion as well as the amendments. We're talking about manpower issues in a professional field. But when it comes to dentists, it's related to the general living standard of Hong Kong people. If because of a shortage in dental service, people can't enjoy a good meal, even if they enjoy a good salary, that will be concerning. Well, people asked how come that if a profession earns $1 million a month, how come that there is still manpower shortage? I'll address the issue later. We have service shortage. And I would like to say that this shortage affects the civil service as well. For civil servants' dental clinics, there is a manpower shortage. A couple of months ago, when we had the public service panel, there was a paper for civil service dental clinics. There is a shortage of 65 dentists, which is about 22% in terms of vacancy, which is a high level. So civil servants will have to wait for a very long time to have their teeth seen to. That is not satisfactory. Civil servants clinics are part of the employment benefits. With the manpower shortage, the benefits have been undermined. I asked the government to address that. If we look at Singapore, they encourage the trade to extend their operating hours, say 9 p.m. Not just public ones, but private ones as well. Our government can come up with some incentives for dentists to work longer hours. According to information from the Dental Council, for non-local graduates in dentistry, they will have to sit for the examination and obtain a permit. In 2018 and 2019, there are 19 and 27 eligible candidates that have passed the examination to practice here, starting from 2020 because of the pandemic. There was only one examination held. Only on part 1, only 5 passed. So I think that the pandemic also has an impact on non-local manpower. Now we have resumption of normalcy. More work should be put into this area to address the problem. Of course, we have to make available dental service to the general public. At the same time, the government should come up with ideas to attract youngsters to join the profession. For those who are in the profession, they should be retained. Would the government consider introducing a mandatory period of service upon graduation, just like in the healthcare system? They do need to do something to address this acute shortage. Does any other member wish to speak? Mr. Chen Hangban, you may now speak on the amendment. I thank the 4 amenders for the amendments. They have supplemented on some ideas in my original motion. Ms. Chen Hoi-yan made some suggestions that I fully agree with. I think they are feasible and they're also contained in our proposal. That is to make good use of dental therapists or dental hygienists. They have professional quality to carry out scaling and filling service, but they will not significantly increase public spending. In relation to Ms. Joephy Chan's amendment, a number of members expressed reservation. I asked these members to support her amendment. She said in the amendment that given the manpower shortage in the coming decade, well, we already have a manpower shortage. It's not just something that will happen in a decade. She also talked about elderly dental care clinic in all 18 districts. But we're talking about dental clinics for the general public, not just for the elderly. However, These are good ideas and should be supported. They complement my original ideas. Mr. David Lam mentioned one point that is worth our support, that is public-private partnership that can be further promoted. Regarding Mr. Lee Chun-keung's amendment, he talked about admitting qualified non-locally trained dental healthcare personnel as appropriate. That's worth our support as well, so I support all 4 amendments and I hope members will do so as well. I so submit.
Secretary for Health. President, I'm very pleased and I'm grateful to members for the valuable comments and suggestions from members today. I'm particularly grateful to Mr. Chen Hanpen's motion on comprehensive review and improvement to Hong Kong's dental service system and manpower needs, and also amendments from 4 members and also 30 members who have spoken on this topic. As I said in my opening remarks, the current dental policy of the government is on prevention and help to the disadvantaged groups and to provide emergency care. The Secretary in his 2022 policy address said that we're going to set a working group on oral health and dental care to comprehensively review existing dental care services and manpower-related issues. Views expressed by members including the submissions from Mr. Chen and Mr. Lee, and that is to formulate a 10-year development strategy for dental services. They will all be conveyed to the working group for its consideration. I'm particularly pleased to hear from members your support for our all-along policy, and that is prevention is better than cure. Mr. Edward Leung said that it's much better to have real teeth than dentures, and Ms. Carmen can talk about 80-20 now. By the age of 80, if you can still have 20 teeth of your own, that is real health. And Dr. Tik Chi-yun talked about a toothless tiger. I think there's can be a warning to the general public. For a tiger which is toothless, then it won't be able to eat, not to mention catch its prey. But an eye for an eye, tooth for a tooth is not the best approach, because it's very costly to give a tiger a tooth implant. It's not just costly, but also dangerous. So it's best that we don't have any toothless tiger. And therefore, prevention is better than cure. And the government has to stress once again that on dental care policy, we want to make use of publicity and education so that everyone attaches importance to oral health. And we should start from young kids. Our oral health education should tell our young kids how to take care of their oral health. And members of the public should also invest in primary health care and in health management. Now, the government just announced as primary health care blueprints recently, and we're going to shift the focus from treatment to prevention. This is also applicable in oral health and dental health. So long as we maintain good oral health habits, we can greatly reduce the need for complicated dental treatment because of dental issues. The government hoped that by means of effective use of resources. Now, Mrs. Regina Ip said that we're now in a rather difficult fiscal position, and we should use our resources effectively. We should encourage the public to have good oral health habits to prevent dental problems. That is better than subsidizing complicated and costly dental treatment, including tooth implant. And for oral health education. I'm pleased to hear from members the importance they attach to oral health, and in particular, they have recognition for our oral health education. The Oral Health Education Division of the Department of Health has various oral health promotion programs targeted at different age groups. And in maternal and child health centers, we have developed pamphlets for oral health care of babies, so that when doctors carry out health and development monitoring of young babies, pamphlets can be given to new parents to take care of the oral health of their babies. And for students in childcare centers and kindergartens, the Department of Health has a Brighter Smiles for the New Generation program. They have new types of teaching materials, so the parents and children can establish good toothbrushing and smart diet habits, so that they learn from young how to brush their teeth properly and to develop smart diet habits to prevent dental problems in the future. The Department of Health has also got a Brighter Smiles Playland, specially designed for 4-year-old children. Children from childcare centers and kindergartens can go there and play for free, so that they can learn good oral care habits through interactive games and activities. The Department of Health will continue to encourage more KGs and CCCs to take part in such programs and activities. And there is also the Bright Smiles mobile classroom and also Bright Smiles campus program to promote oral health. We have a bus and also school-based and outreaching approach to promote oral health to KG and CCC students. As regards whether we can have oral or school dental care services for KG kids like what we do for primary school students, I think this is a good suggestion the working group will consider. The Dental School of Hong Kong U has got a subvention from the Jockey Club Charities Fund. They have started a Jockey Club preschool oral health program. Starting from 2020-21, KG children or young kids can join the scheme on a voluntary basis. They can receive dental checkup, and if they have dental decay, they will be given treatment, and parents are taught how to handle dental health issues. The program we will consider whether the program can be extended to other age groups. Now, the Department of Health has also got promotion activities for secondary schools, including one called Teens Health, and there is also the Lofty campaign, and senior secondary students are trained to promote and educate lower form schoolmates. They become mentors. They will serve as peer leaders to educate their fellow schoolmates the importance of oral health care and hygiene. Every year, the Department of Health has got a theme-based Love Tea campaign using the mass media to promote oral health to everyone in the community. Such promotional activities and the extension of school dental care services to kindergartens will wait for the final recommendations of the working group on oral health and dental care. Mr. Lai Tong Kok talked about oral health objectives, that they were established in 1991. In 2019, the Department of Health set up an expert group to review our oral health objectives. Members include representatives from the Faculty of Dentistry of the University of Hong Kong, the Hong Kong Dental Association, the College of Dental Surgeons of Hong Kong, and dental experts from the Department of Health. The expert group has reviewed the objectives set back then, and according to the expert group, the target days are far too away. The targets were set for 2010 and 2025 respectively, and there might be unforeseen changes during the long period. So the goals were set in 1991 for all the way to 2025. Those goals might be already outdated. So based on the findings of the oral health survey done in 2021, the expert group will set more appropriate targets for 2030, and they will advise the government in a timely manner acceptable or feasible suggestions. As for public dental health services, many members have commented on our current services. I have to stress that general dental services are mainly provided by the private sector and an NGO. Dentists serving the public sector account for less than 10% of the dentists in Hong Kong, and we face a manpower shortage in public dental health care. We have 300 or so dentists in our establishment, but the vacancies are over 70. So we cannot just use money to compete with the private sector when it comes to manpower recruitment. Given the situation, the government will focus its resources on emergency dental services and specific groups, which I elaborated on earlier on, and will not repeat those details. So the positioning of our public health care and dental sector will be reviewed by the working group. Dr. Priscilla Leung asked whether we can have mobile dental vehicles to provide services. That will be considered by the working group again. Elderly health care vouchers scheme again is a subject close to the heart of members. It is suggested that we should have a dedicated voucher scheme for dental services. Yes, there are merits to this suggestion, but then it would affect the flexibility and autonomy of the general public. Some members of the public may not have as great a need for dental services. The 2022 announced that the government is going to introduce a 3-year pilot scheme. So the $2,000 medical healthcare voucher scheme will be increased to $2,500. The $500 will be deposited into the account of the user after he has spent $1,000 on primary health care services for prevention and health management. I think this is addressed what Mr. Gary Chen said. The earlier we invest money in dental prevention and health care, the better. Because you don't have to spend too much. It's just like a vehicle. If you have a regular maintenance, you don't have to wait until it has broken down or after you have a crash. So this is actually a critical point in primary health care. So we want to place our healthcare voucher on health management and prevention. So prevention and health management should include dental care services. We encourage our elderly persons to make good use of our healthcare vouchers to protect their dental health. When the details are available, we will announce to the public. Many members just now expressed their concern for cross-boundary dental services. Indeed, the current healthcare voucher scheme is applicable in the Sham Chun Hospital of the Hong Kong University. elders can use the voucher in the Assumption Hospital of Hong Kong University. The hospital has got a very popular dental service as well. After we've resumed normal cross-boundary travel, this is a very welcome move by the public. And then members of the public may choose to cross the border and use the healthcare voucher at the Assumption Hospital. The Bureau will continue to cooperate with the Assumption municipal government. Hopefully, we can have more cross-boundary medical services. We will also examine how we can enhance our collaboration to extend the scope of the application of our voucher. Another concern is manpower supply. Members have expressed their concern on this. Indeed, supply and demand of manpower will have a major impact on services. Now, if we must enhance our service capacity, then we need to adopt a multi-pronged approach, not just a dual-pronged approach. As I mentioned in my opening remarks, we have increased the UGC-funded first-degree intake places for dentistry from 80 to 90. In the coming 5 years, there will be over 400 new dental graduates joining our service. And then we have increased graduate places. We have 10 additional places to train dental specialists. And we are going to introduce non-locally trained dentists as well, so that they can provide dental services in Hong Kong. We are now working on the details of the proposal, and we're going to consult the relevant stakeholders. Depending on the progress of our discussion, our goal is to try to submit the alleged proposals to introduce non-locally trained doctors to Hong Kong within this year. Now, to increase manpower supply, we'll consider allowing eligible dentists. We may require them to serve for a certain period of time in the public sector. That would include non-locally trained dentists to be introduced to our public sector. They may be required to serve in our public dental sector for a while, so that they can familiarize themselves with our system. That will be beneficial to them as well. And for newly trained dentists, they'll have the opportunity to serve in our public sector, so that they can be given in-service training as well. Lastly, to train supplementary dental health professionals, including our dental hygienists and dental therapists. We will consider how we can train more paradental staff. I have to stress that these measures are not for the short term. Many of them will take a while before they can help us to resolve the problem. The government will consider the scope and efficacy and cost effectiveness of the existing oral health measures. As I said, in last December, we set up the working group on oral health and dental health to review various aspects of oral health and dental care services. It is going to advise the government on our relevant policy objectives, service scope, and service delivery model. The working group will advise the government on the following aspects. First, the scope, efficacy, and cost effectiveness of the existing oral health measures and dental care services undertaken by the government, having regard to local circumstances and experience, as well as overseas practices and evidence. Second, aspect of work of the working group is the long-term strategy for oral health and dental care in Hong Kong, in particular as part of primary health care, including coordination of service programs and manpower provision with a view to enhancing the oral health of the community. And the third aspect of work of the working group is priority areas for enhancements to oral health measures and dental care services, including the level of essential primary dental care services required by citizens at different life stages, the scope of publicly funded or provided dental care services, and modes of delivery and financing. Membership of the working group include the local dental professionals and relevant experts and stakeholders. We will consider local circumstances as well as overseas practices in coming up with the long-term policies. Members' suggestions on this subject will be relate to the working group for detailed consideration to come up with a feasible plan to promote the oral health of the public in the long run. Thank you.
I now call upon Ms. Hoi-yan to move an amendment. President, I move my amendment. I propose the question to you that Ms. Hoi-yan's amendment be passed, and I'll put the question to you as stated. Will those in favor please raise their hands? Those against please raise their hands. I think the question is agreed by majority of each of the two groups of members present. I declare the amendment passed. Ms. Joephy Chan, as Ms. Hoi-yan's amendment has been passed, you may move your further amendment. President, I move my further amendment. I propose the question to you that Ms. Joephy Chan's further amendment be passed, and I'll put the question to you as stated. Those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Mr. David Lam, as the amendments of Ms. Hoi-yan and Ms. Joephy Chan have been passed, you may move your further amendment. President, I move my further amendment. I propose the question to you that Dr. David Lam's further amendment be passed. Will those in favor please raise their hands? Those against please raise their hands. I think the question is agreed by majority of each of the two groups of members present. I declare the amendment passed. Mr. Chun-keung, as the amendments of Ms. Hoi-yan, Ms. Joephy Chan, and Dr. David Lam have been passed, you may move your further amendment. President, I move my further amendment. I've proposed a question to you that Mr. Chun-keung's further amendment be passed. Those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present, that is, those returned by election committee and those returned by FC and GC. I declare the amendment passed. Mr. Chan, you have 48 seconds. Well, we're here to talk about dental service. We feel sad about elderly people having to queue overnight. We feel indignant. In order to further promote better dental service, I myself and Ms. Starry Lee have made this proposal for 10-year dental service blueprint. We hope that this proposal can be taken forward. 10 years is the timetable. We also have a roadmap of short, medium, long-term measures. We hope that the task force will take on board the original motion as well as the proposal so that we'll have adequate service. I so submit. Thank you. And I'll put the question to you that Mr. Ben Chan's motion as amended by Ms. Hoi-yan, Ms. Joephy Chan, Dr. David Lam, and Mr. Chun-keung be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the motion as amended passed.
Members' motion with no legislative effect.